Works a day early on Capitol Hill this week as Congress passes President Donald Trump's spending plan before the self-imposed July 4th deadline.
The plan focuses a lot on taxes. The measure will ban taxes on tips, and it will cap state and local tax deductions. It will also drop taxes on interest of U.S.-made auto loans. There are about $4.5 trillion in tax cuts in the bill. To make it work, the bill will roll back significant safety nets like SNAP and Medicaid. They're doing that by adding federally mandated work requirements to those programs. The nonpartisan Congressional Budget Office estimates the bill will add more than $3 trillion to the national debt.
This bill is all in service to taking care of the wealthiest, most fortunate Americans. It explodes the deficit and it raises the debt ceiling by $5 trillion to give tax breaks to the wealthy.
This bill is President Trump's Make America Great Again agenda being codified into law. From Minnesota to Texas and Maine to California, there are wins in this legislation for every single American.
In both the U.S. House and Senate, Alabama's congressional delegates voted along party lines. Republicans in favor of the spending measures, Democrats opposed. WSFA 12 News reporter Emma Ellis heard from Alabama representatives and the Alabama Hospital Association about how the bill could impact them.
There's been much debate on how the Trump administration's big, beautiful bill will affect health care in Alabama. The bill will provide $50 million to rural health care systems across the country. Alabama Representative Barry Moore says this will help hospitals in Alabama significantly.
I have the most rural hospitals of any member in Alabama's congressional district, so that's good for my hospitals and for my local communities.
But Alabama Representative Terry Sewell says this money will not be enough to counteract the impacts the bill's cuts to Medicaid will have on rural hospitals.
The fear of hospital closures is real. In fact, this bill is anticipated to close 330 hospitals across this country, including 5 hospitals in Alabama.
CEO of the Alabama Hospital Association, Dane Howard, says if Alabamians lose their Medicaid coverage and are unable to afford insurance from the marketplace, it could inundate our emergency rooms.
That will have a negative impact as we have more uninsured individuals seeking care in hospital emergency rooms, and that increases the amount of uncompensated care that's delivered.
Sewell has referred to the bill as the big ugly bill and says she will continue to fight against it.
It's fiscally unsound, it's fiscally irresponsible, and I think it's morally, irreprehensible.
But Moore says this bill is a step to achieve the Trump administration's goals.
His bill, it's his opportunity, and it's our opportunity to help the president move that America First agenda.
Sewell estimates 170,000 Alabamians will lose Medicaid coverage because of the big, beautiful bill. And Mark Howard says it's still unclear right now what all of the effects this bill will have on Alabama's health care system.
Emma Ellis with that part of the story for us tonight. Thank you, Emma. President Trump is expected to sign the bill into law on the 4th of July. Well, our holiday, it's not tonight, it's tomorrow.